Talking health, anesthesiologists at the 30th Annual Scientific Conference and General Meeting in Abuja are urging the government to encourage the funding and recognition of specialist training for anesthesia, which will help technological advancement in the nation's practice. This forms the crux of the meeting, which also highlighted the need to improve local research standards in order to further reduce the challenges of brain drain being faced by the country. Health correspondent Kemi Balogun has details.
Anesthesia remains an essential part of secondary healthcare services, which is not only limited to the operating room, but also emergency room, intensive care unit, and other life-saving hospital services. In Nigeria, there seems to be a crisis in the physician anesthesia workforce due to the lack of physician-led anesthesia care. This has recently been largely due to the massive exodus of the healthcare workforce, including anesthetists.
I have nothing to disclose today.
The 30th Annual Scientific Conference and General Meeting of the Nigerian Society of Anesthetists is starting with the theme, Technology for the Advancement of Anesthesia. Experts here believe that the gains of the practice can only be fully achieved through effective local research funding, recognition of specialty training certificates, and the proper remuneration of their services, which was not included in the National Health Insurance Act, as well as issues surrounding brain drain.
We have a middle level manpower. A diploma in anesthesia. They are specialists in anesthesia with diploma. They used to be recognized as an additional qualification, but since this year, 2022, they are no longer certified as additional qualification by the Medical and Dental Council of Nigeria. So that is a big discouragement.
We do have more people who are now involved in research in anesthesia particularly, and who are remaining here in the country. They are able to attract grants to their various institutions, and also we are calling on the federal government to also increase the funding of research grants in our tertiary institutions.
We note the non-inclusion of anesthesia, intensive care and pain management in the National Health Insurance Act as operated by the National Health Insurance Agency. The ministry is willing to work with the NHIA and all stakeholders to investigate this area of need.
The practice currently only accounts for a little over 800 anesthetists for a population of over 200 million. The government says it will look into the situation and find solutions to this worrisome trend. Kemi Balogun, TVC News, Abuja.